I am so very proud of our remarkable past, our exceptional present, and our shared transformative future. With great excitement today, I announce the advancement of the mission that we share with every member and every healthcare institution to achieve excellence in nursing. A landmark transformative quality improvement collaboration with RQI, an AHA and Laerdal company, and the NLN. With repetitive, easy access for students and faculty to an essential skill for saving lives of patients and individuals in the community, we offer with our partners the RQI program. With adoption of this innovative technology, your institution can play a pivotal life-saving role. Together, we will help nursing programs prepare their nurses with resuscitation competence and maximize the life-saving ability of nurses and other healthcare providers. Colleagues, welcome. Today we are celebrating a new era in healthcare education, where our remarkable past and exceptional present intersect to position us for a shared transformative future. Last September, at our annual National League for Nursing Education Summit, we announced a new partnership and collaboration with Laerdal Medical to help advance transformation of the standard of resuscitation care for cardiac arrest. Together, along with RQI partners, the partnership between Laerdal and the American Heart Association, we made a commitment to support resuscitation quality improvement, or RQI, program adoption by nursing programs at higher education institutions. This innovative program will help elevate high-quality CPR skills and prepare future nursing professionals to respond to cardiac arrest events competently and confidently, leading to improvement in survival rates. Now, 6 months later, the NLN, Laerdal, the American Heart Association, and RQI partners are excited to announce and recognize 12 nursing programs from colleges and universities across the country that have taken the bold step as early adopters of the RQI program. They are our NLN Change Agents. The NLN and our partners are aiming for excellence, defined simply as co-creating and implementing transformative strategies with daring ingenuity. Excellence will be achieved through collaboration with the NLN, Laerdal, and RQI partners and the NLN Change Agents. Together, we will help perfect and deliver a first ever, highly reliable, progressive quality program tailored to the more than 150,000 students who graduate annually from nursing and allied health education programs at U.S. colleges and universities. Today's celebration is the next pivotal phase in fulfilling our shared mission to further the health of this nation and the global community, achieve excellence in nursing education, and most importantly, help save more lives. What a moment in time. I'd like to now ask Alf Christian Dybdahl, Chief Executive Officer at Laerdal Medical, our long-term collaborator and partner in this endeavor, John Miner, American Heart Association, Chief of Mission Aligned Businesses and Healthcare Solutions, and Brian Eigel, RQI Partners, Chief Executive Officer, to share a few words. Alf Christian.
Thank you, Dr. Malone. I'm so excited to join to recognize these 12 nursing programs. In addition to salute these schools and the important contribution they're making to resuscitation education in higher education, I also view this as a celebration for the nearly 2-decade-long relationship between Laerdal and the NLN, and our shared stand to advance excellence in nurse education with a lens on resuscitation competence and confidence. Since introducing RQI in 2015, in collaboration with the American Heart Association, more than 2,400 hospitals and 2 million nurses have adopted and enrolled in the program. More significantly, we estimate that 20,000 lives have been saved. And now we bring RQI to our nurses of tomorrow, helping the NLN uphold its commitment to members to offer innovative products and dynamic experiences tailored to learners, faculty, and administrators' unique needs, and heighten the potential to save even more lives. Congratulations for helping us mark this significant milestone. Your leadership in being among the first to introduce RQI to nursing exemplifies how, together, we are creating a new community and culture of competency-based resuscitation excellence. John?
Thank you, Alf Christian. We'll hear from one of the pioneering nurse educators shortly, whose work was the spark that ignited the development and the launch of RQI Partners program, and solidified our organization's longstanding commitment as strategic partners to lead innovative change in healthcare. Without the vision and dedication of the NLN, Dr. Dortman and Dr. Carnegron, RQI would have never happened. In addition to RQI, I'd like to highlight a few other significant events that can be attributed. In 2018, we called for a new standard of care by shifting resuscitation practice from compliance to verified competence for healthcare professionals. In the same year, we also formed the dedicated company RQI Partners to help advance our shared mission to save more lives. We created the current RQI simulation solutions and e-learning platforms for sustainable quality improvement in cardiac arrest resuscitation, introducing them for the first time ever simultaneously with the release of new science guidelines. As you can see, we've established a trend of historic firsts. And now we're exploring how nursing education programs in our nation's colleges and universities can embrace RQI. To each of the schools represented today, welcome to the RQI community, and thank you for your efforts to keep the trend alive and to influence change in healthcare. Brian?
Thank you, John. RQI Partners was born from a decades-long alliance between the American Heart Association and Laerdal Medical. Our charge is to accelerate and influence RQI program adoption across the healthcare industry with an emphasis on hospitals and EMS agencies and organizations. 4 years later, we're excited to closely collaborate with the 12-member schools gathered here today, the many nursing students, the National League for Nursing, Laerdal, and the American Heart Association to unleash and elevate RQI's potential in higher education. Alf Christian mentioned community in his remarks. Accelerating and influencing program adoption positions us to ensure healthcare professionals with verified high-quality CPR competence are thriving in every community. Then, and only then, can we impact and improve survival from cardiac arrest. I'm excited and look forward to harnessing our collective purpose, passion, and power to further excellence in nursing education by offering students this new unique pathway to verified CPR competence. Thank you for joining us on this very important journey. I will now turn the virtual microphone over to Stephanie Brown, who will help us introduce our NLN Change Agents. Stephanie?
Thank you, Brian. And now, let's meet our 12 NLN Change Agents from colleges and universities across these United States. Our first stop, we travel to Indiana to visit Anderson University.
I am Dr. Lynn Schmidt, Dean of Nursing and Kinesiology, representing Anderson University. Anderson University is the home of the Ravens. Today, more than 1,300 students are on their journey at Anderson University, discovering real life together. We will launch RQI this spring with 72 nursing students, with the anticipation of 105 nursing students and 41 exercise science students in fall of 2022. The implementation of RQI will help our students to increase their confidence and competence in resuscitation and to maximize their life-saving abilities. A majority of our clinical partners are utilizing RQI in their healthcare settings, so our students will graduate with knowledge and experience in RQI, helping to make a smooth transition from student to professional. This is one more example of how AU learning experience is distinctive and compelling. Thank you.
Thank you, Lynn, for kicking off our trip around the country. Next, we're going to dart over to Indiana's neighbor. Let's hear from Michigan State University in East Lansing.
Hi, my name is Kathleen Poindexter, and I'm currently the Interim Associate Dean for Academic Affairs and Faculty Development at Michigan State University College of Nursing. Fun fact about our college, we have a long history of being early adopters of evidence-based practices and implemented virtual learning dating back more than 30 years ago. Our college currently offers BSN, MSN, DNP, and PhD programs, and we have more than 7,500 living alumni working around the globe. The College of Nursing is a member of one of the first accredited learning assessment centers in partnership with human medicine, osteopathic medicine, and veterinary medicine to conduct assessment, research, and interdisciplinary healthcare education to achieve optimal patient outcomes and improve overall healthcare systems. Approximately 100 of our BSN nursing students will participate in the initial RQI pilot, with plans to expand use across the College of Nursing and with our partnering healthcare colleges expanding to the Learning Assessment Center. We're very excited to have been selected as one of NLN's change agents aimed at improving resuscitation outcomes. We are an evidence-based practice program with an emphasis on translation of research to practice. This is a tremendous opportunity for nursing to lead the way and role model a cutting-edge practice change based on the latest research for faculty, students, and our healthcare peers. Together, we all will save more lives.
Dean Poindexter beautifully said, you're so right, it's all about saving more lives. Now we're headed to the Carolinas, Durham to be exact, North Carolina Central University.
My name is Dr. Yolanda Van Riel, the Department Chair of Nursing at North Carolina Central University, an historically Black university and home of the Eagles. NCCU is the first public liberal arts institution for African Americans in the United States and the first University of North Carolina system campus to require community service for graduation. North Carolina Central University gained national recognition from the Carnegie Foundation as a community-engaged university, exemplifying the motto, truth and service. There are 4 options: traditional, accelerated, RN to BSN, and veterans. The number of participating students will be 91. Participation as an NLN Change Agent supports the mission of the nursing department to prepare compassionate and caring nurse leaders in healthcare who transform communities. NCCU's Department of Nursing will be known for improving the quality and reliability of care students provide and improve outcomes in acute care and the community. Thank you.
Dr. Van Riel, it sounds like the university also has a trend of historic first. Kudos to you and the university. And we are going back to Indiana. In addition to being the home state of the Jackson 5, the world famous Jackson 5, it's also home to Purdue University Northwest.
Good morning. Thank you all for joining me today. I'm Amanda Cradaville. I'm from Purdue University Northwest College of Nursing. We have two campuses in Indiana, about 35 miles from each other, one here in Hammond, where I am, and another in Westville. And we are an NLN Center of Excellence and home of the Pride. So for our plan in implementing the RQI program into our College of Nursing is that eventually our RQI program will run on both campuses with approximately 360 students. But first, we know that pilots are important, and we plan to pilot this program later in the spring or perhaps the summer with a smaller group of approximately 30 students. For us, our College of Nursing, the participation as an NLN Change Agent means that we are preparing our student nurses to become professional nurses using evidence-based strategies, which are a staple in our curriculum. We are proud to be a part of this groundbreaking work that's going to prepare our students now to improve the standard of care, helping to bridge the gap between practice and education. We also recognize that this is going to give our students a great advantage when they become professional nurses, as many of our local hospital partners currently do use the RQI program. We are very excited for the possibilities that RQI will bring to the profession of nursing and the standard of care. Thank you.
Thank you, Amanda. I love to hear that local hospital partners already using RQI. That's a fantastic story. And arriving at our fifth stop, we are heading to the East Coast to Rutgers University.
Good afternoon. I'm Kevin Emmons, Associate Dean for Interprofessional Practice, Education, and Innovation. I'm joined here today with our Dean, Dr. Donna Nikitas. We're representing the Rutgers School of Nursing in Camden, New Jersey. The Rutgers School of Nursing Camden is an NLN Center of Excellence for creating environments that enhance student learning and professional development. It houses the only accredited simulation center in Southern New Jersey, and we are designated as a minority serving institution. The Rutgers School of Nursing Camden is located obviously in the city of Camden, which is across from Philadelphia. Camden is home of the Victor Talking Machine, also known as RCA, and most importantly, Campbell's Soup. The initial implementation of the program will include our Level 1 accelerated undergraduate students, approximately 50 in the first cohort. After the initial rollout, we intend to expand the initiative to our 1,000 undergraduate students across programs, our graduate students, and eventually our community partners as part of our Center for Interprofessional Practice and Education. The School of Nursing is dedicated to improving nursing education through innovative learning models and competency-based learning. This opportunity will help transform our methods of resuscitation education, and most importantly, help with saving more lives in the Philadelphia region and across the United States. Thank you.
Thank you.
Thank you both. The reach within the university as well as in the community, that's fantastic. And jumping down south, we have the University of Alabama, Huntsville.
Good afternoon. My name is Dr. Karen Frith, and I'm the Dean of the College of Nursing at the University of Alabama. And joining me today is Dr. Joseph Chamness, the Administrator for RQI. UAH is a Research 1 university as designated by the Carnegie Classification System. We're located 1 mile from the NASA Marshall Space Flight Center and the U.S. Army Missile Command at Redstone Arsenal. Just 3 miles from our campus is the 6th largest public hospital system in the country. The College of Nursing has over 1,100 undergraduate and graduate students and offers a full range of programs from BSN to PhD. We have 56 pre-licensure students starting in the RQI program with plans to increase in the fall semester. The College of Nursing is an NLN Center of Excellence for pedagogical expertise of our faculty, and we have many faculty who are certified nurse educators. Being an NLN Change Agent is an important way to ensure student competency in this life-saving skill. Being a change agent also demonstrates our core values to use research evidence to strive for excellence in patient care. Thank you.
Great, Dr. Frith, thank you for giving us a glimpse into the university's plans. So now we're going to make a quick U-turn and we are going to head back north to Ohio, to the University of Cincinnati.
Hello, everyone. I'm Robin Wagner. I am the Director of Simulation at the UC College of Nursing, as well as an Associate Professor here. I have with me Dr. Angela Clark. She is our Interim Associate Dean, Executive Director of Undergraduate and Pre-Licensure Programs, and also an Associate Professor of Nursing here at the college. UC was originally founded in 1889, but then in 1916 was the first college in the country to offer a BSN. We will have 45 of our pre-licensure accelerated students involved in this initial program, with plans to expand across the programs as we move forward. The University of Cincinnati College of Nursing is honored to have been chosen as an NLN Change Agent. This collaboration helps our faculty bring our vision to life by creatively leveraging technology and innovation to lead and impact the transformation of healthcare through strategic partnerships just like this. Being part of the NLN Resuscitation Quality Improvement Program also allows UC Nursing to advance our mission by ensuring our graduates are empowered to provide leading-edge, patient-centered care in any setting. You see nurses, we see leaders. Thank you.
Thank you both, and congratulations on the distinction as the first college in the country to offer a BSN. And it's back to the East Coast with the University of Delaware.
Hello, I am Dr. Heidi DiGregorio, Director of Simulation and Interprofessional Education at the University of Delaware School of Nursing. We are a National League of Nursing Center of Excellence and the only academic center in Delaware that is currently simulation accredited. We are generally known as the Delaware Blue Hens. However, locally, we're famous for our UD Creamery, which makes and sells homemade ice cream. And as part of this improvement program, we will have approximately 50 pre-licensure baccalaureate nursing students that will start this program. However, we're hoping to expand to not only include our graduate nursing students, but also into other disciplines within the College of Health Sciences. University of Delaware School of Nursing's mission includes advancing health through education and improving healthcare delivery globally. So participation as a change agent not only supports our mission, but will help our students see the benefit of participation and transforming cardiopulmonary resuscitation education in a global perspective. As faculty members, we are very excited to be part of this initiative. We see participation as coming alongside our students and inspiring them to be leaders of change, while also improving survival for those who need CPR. Thank you.
Thank you, Heidi. Inspiring students to be leaders of change and improving survival, that's a perfect combination. And if you thought we were leaving the East Coast, not quite yet. We are staying on the East Coast, and we have the University of Massachusetts, Boston.
Good morning. My name is Rosemary Samia, and I'm the director of the Center for Clinical Education and Research here at UMass Boston. We're the only public nursing program here in the city.
Good morning. I'm Carlos Salas, and I'm on the faculty for the college's Exercise and Health Sciences Department. As UMass Deacons, we are excited to be an early adopter of RQI. This initiative is a step forward for our two departments to work together for the betterment of our patients and our clients.
Our college is going to start by rolling this program out to approximately 50 students who have been recently admitted into our accelerated undergraduate nursing program. And we have plans to implement RQI with larger cohorts and other programs within the college. Participation as an NLN change agent demonstrates that our faculty value the importance of quality CPR and skills retainment, not only for the students in our college, but for all members of our campus. Here at UMass, we're very committed to ensuring that our students are prepared to respond to emergencies, both in the hospitals and within our communities. Thank you.
Thank you both. And Rosemary, your last comment about community, in the clinical setting and community, that takes us back to Brian's remarks on thriving in every community. Okay, so I hope you're enjoying the trip. We have 3 more stops on this trek across the United States, and we are returning to Ohio to spend a few minutes with Ursuline College.
Hello, I'm Dr. Kimberly Dillon Blake, the Associate Dean for Undergraduate Nursing at the Breen School of Nursing and Health Professions at Ursuline College, just outside of Cleveland, Ohio. Ursuline College's Breen School of Nursing is designated as an NLN Center of Excellence. As a Center of Excellence, our students benefit from our strong and long-standing clinical partnerships with some of the nation's best hospitals, including the Cleveland Clinic. As we embark on the process of onboarding our first 50 students into the RQI program, our faculty are excited not only to be a change agent with RQI, but because they know our students will be even better prepared to transition to competent, safe clinical practice. Thank you.
And we are equally excited to count Ursuline College among the first. Next, we travel to Kansas, Wichita State University, Campus of Applied Sciences and Technology, or as it's affectionately known, WSU Tech.
Welcome to Wichita, Kansas, the air capital of the world. My name is Pat Plank. I'm the Associate Dean Nursing Programs at WSU Tech. WSU Tech is the largest 2-year technical college in Kansas and the 4th largest 2-year technical college in the country. Our nursing program currently is a practical nursing program, and we graduate over 110 students each year. At the request of our clinical partners, we are in the process of establishing an associate degree nursing program, which we hope to begin this fall with 20 students. We are implementing the RQI project with 75 of our first semester PN students and hope to expand it to the ADN program and then also to some of our other health sciences programs here at the Tech College. Thank you.
Great, thank you. From the air capital of the world, thank you, Dean Plank. We appreciate it. Our 12th NLN Change Agent, unfortunately unable to join us today, hails from the great state of Utah, Western Governors University. To all of our NLN Change Agents, our 12 NLN Change Agents, I now have another reason why the number 12 is my favorite number. Thank you for providing insight into the impact of each of your nursing programs' participation and enrollment in the RQI program. Again, congratulations on your selection as NLN Change Agents and your role as an early adopter of the RQI program. And now, at this time, we will hear from Dr. Marilyn Orman, whose research and studies, in collaboration with Dr. Susie Cardong-Egren, first confirmed the significant value of low-dose, high-frequency resuscitation education.
Thank you, Stephanie. We have known for years that CPR skills need to be used or practiced to maintain competency, but not many people have done much about that. Well, the NLN and Laerdal funded 2 important research studies done with nursing students that provided evidence of how much practice nurses and other healthcare providers really need to maintain their CPR skills. In the first study, with more than 600 nursing students, we confirmed that brief practice of CPR on mannequins that provided automated feedback on performance. For example, the mannequin said, "Don't compress so fast," or "Ventilate more slowly." This automated feedback was effective for students to maintain their skills, but we didn't know at the time how much practice was really needed. In the second study, also funded by the National League for Nursing and Laerdal, 475 beginning nursing students in 10 nursing programs, ADN and BSN, across the United States were randomly assigned into different training groups to learn more about the spacing of practice for CPR. In this study, students practiced their CPR skills on the RQI, Resuscitation Quality Improvement Mobile Simulation Station. As students perform compressions and bag mask ventilations, they not only hear from the computer, but they can view their performance in real time on the computer screen. And students can use this visual feedback to guide their compressions and ventilation. I think a really important finding in this study for everybody to think about, every student who began this study had been certified in BLS prior to the study. So keep that in mind. But they were not able to perform compressions and ventilations at pretest. Only about 20% even maintained their skills. So the skills that they developed when they completed their BLS course and entered your nursing program had already deteriorated by the time we got our study started. But with RQI, student CPR skills not only were maintained, but they improved in quality over time. Well, this is our chance for nursing to be the leader in transforming resuscitation education. We are the first healthcare profession to do this, and we're being led by nurse educators. In nursing education, we talk about translating research into practice, about using evidence to change practice. The 12 NLN Change Agents are doing this now in real time. These schools of nursing are taking the research findings and implementing them to improve patient outcomes. This has never been done before. Individual researchers conduct studies. We publish them, but then we usually leave it to others, people who read those studies, to figure out how to apply the findings to make a difference. Laerdal and the NLN, with these 12 change agents, are completing the entire cycle of research and evidence-based practice. These schools are paving the way for other nursing programs and ensuring that future nurses are skilled in CPR. Thank you to the 12 change agents for doing this and really leading the way in nursing education and healthcare. Dr. Malone, back to you.
Dr. Orman, you are truly one of my heroes. Thank you so much for joining us today to celebrate these deans and schools that are taking your and Dr. Cotton Edgren's research-based findings to heart as early adopters of the RQI program. As I shared last fall at the NL Education Summit, we are so grateful for your contributions in moving science and research into reality within 5 years, resulting in a quality improvement program that will prepare better future nursing students for their transition to clinical practice. Again, thank you. And to the 12 schools, we have a groundbreaking and game-changing opportunity before us to maximize the life-saving potential of nurses and other healthcare professionals. The NLN, Laerdal, the American Heart Association, and RQI partners salute you, your faculty and staff, and the many nursing students who have joined our partnership in quality improvement in resuscitation as we collectively usher in a new era in healthcare education. Thank you.